Let us take a look at one of the most basic and simple uses of kinesiology tape to desensitize painful tissue. First of all, what is my intention as a therapist or movement therapist when it comes to pain? We certainly know what it means from a contraindication point of view. We don't want to be digging around in there, and we don't want to be pushing those clients further down that pain path. But what we do want to do, especially in the early stages of acute injuries, but also for long-term pain, is to desensitize that tissue, try and get our clients pain-free so that we can then move without pain, without that oversensitivity that sometimes stops our clients creating the movements and strengthening the tissues in the way they need to make long-term changes. So what does that mean from a tape point of view? What we want to do is create a lift on that tissue using that recoil. Okay, so what we want to do here is have a direct lift on the skin above that area. One, to stimulate as large a part of that affected tissue as possible and to create that lift, that constant stimulation. So this is not directional. It is about creating that lift directly on top of the sensitized area. We're looking to just reduce pressure in that area and stimulate as many sensory receptors as possible. And by doing that, what we're hoping to achieve is desensitized or reduced pain in the tissues themselves. So what is the process? How do we achieve that? And I think if you can keep in mind that that pain is about creating a lift above the area, a reduction in pressure, then the process makes sense. We want the active piece of tape, we want that recoil to be up. So it's not about proximal to distal, towards the body, away from the body. It's about directly over the area. So we place the active piece of tape down first. So we peel the tape back in the middle, we put a light tension or stretch on the tape and place it down directly over the target or sensitized tissue while the tissue's on stretch. Then we anchor with no tension, no stretch on the tissue. So let's look at a really simple example here for rhomboid pain. This client has pain in that rhomboid area coming from a bit of a winging in the scapula. So what I want to do before I do any corrective work is to reduce that sensitized tissue. So as you can see, I tore that tape in the middle, applied a light stretch. I'm going to do it again because we can layer these, so tear it in the middle. A light stretch or tension on the tape itself, so just a light pull, and then straight down over the tissue. And as you can see, my client's rounding her shoulders. She's putting that tissue on stretch, and then we anchor with no tension at all. So that's tear the tape in the middle, apply a light amount of tension, and place it down on the tissue while it's on stretch. Then simply anchor with no tension and no stretch on the tissue. Note that more pieces of tape means that you simply have more lift in the area. So one can be suffice, but sometimes more than one is required. In this next example, we're going to look at pain in the calf, but this time we're going to layer the tape again in what we call a star method. So one or more pieces of tape can be used for this approach. We're going to use the same approach here. So remember, it's about the middle piece of the tape being the active piece of the tape. So I tear from the middle of the tape to expose the middle of the tape to be used as the active tape. I then add a light amount of stretch onto the tissue. I ask my client to stretch, and then I place the tape down. Anchor with no tension and no stretch. So let's watch that again. So we're going to build a star here. So we're going to use 3 or 4 pieces of tape. Again, we tear in the middle. We expose that active piece of tape, light stretch or tension, straight down over the painful area. You can't see in this picture, but my client is moving from plantar to dorsiflexion. So they're putting the calf on stretch when they lay the active tissue down. So once again, tear in the middle. Add a light stretch or tension to the middle of the tape. Client stretches the calf. We place it down over the painful area. Anchor with no tension and no stretch. So let's summarise the process for desensitisation. The active tape is the middle piece. We're going to tear the tape in the middle, apply a light amount of stretch or tension to the tape. Ask our client to put that tissue on stretch and we place it down directly over the sensitised or painful area. We then ask our client to relax and we anchor the tape with no tension or stretch. So the active piece of tape, light tension or stretch on the tape, target tissue on stretch, place it down directly over the target tissue, and as always, anchor with no tension and no stretch.